Welcome to my channel Innovate. In this video, we will going to discuss about the anatomy of urinary bladder, and we will also going to discuss about the innervation of urinary bladder. So, we will going to cover the urinary bladder anatomy, and also we will going to discuss about the innervation that is important for the milk urination reflex. Now, starting from the anatomy of the urinary bladder, the urinary bladder here you can see is a hollow viscous structure. It is a hollow viscous organ that is used to store the urine until it is micturated to the exterior. The urinary bladder is present in the true pelvis. When it is empty, it is present in the true pelvis, and its anterior surface, the apex of urinary bladder, is lying posterior to the pubic symphysis. So you can assume the position of urinary bladder in a human being that the resting urinary bladder lie in the true pelvis. The parts of the urinary bladder, here you can see it has an apex. The base of the urinary bladder is the posterior surface, the superior surface, and the inferior lateral surface of urinary bladder. Also, the urinary bladder will going to empty into the urethra that is present at the area called as the neck of urinary bladder. We are going to discuss each and every part of the urinary bladder one by one. Also, one more important thing here is that there are the two ureters that are going to pierce the urinary bladder at the level of the posterior surface of the base. That is the presence of trigone. Here in this diagram, you can clearly see this is a trigone that is present in the posterior surface of the urinary bladder, and it is a smooth area that having an opening from the two ureters and that enter into the internal urethral orifice at its lower medial end. From the internal urethral orifice, urine is excreted into the urethra and then to the exterior. So this was about the trigone that is present at the base of the urinary bladder. But the structures also present in the urinary bladder are: the first one is the apex. Here you can see the urinary bladder is pinched towards the apex of urinary bladder, and the apex is having an important ligament, that is a median umbilical ligament. This median umbilical ligament is a remnant of a urachus, and it is attached to the anterior apex side of the urinary bladder. On the superior side of urinary bladder, here you can see the openings of the ureters and covered over the urinary bladder. And then on the inferior lateral side of urinary bladder, the base of the urinary bladder mixes to form the neck of urinary bladder. That is an area where the urethra opens, and this neck of urinary bladder is connected with the pubic bone by the pubovesical ligament. Now we can see the urinary bladder also having a body. The whole base, you can say the whole base plus the superior surface and the inferior lateral surface are considered as a body of urinary bladder. And that body, in the zoom diagram, here you can see if you cut the urinary bladder, we can see this is the coronal section of a urinary bladder showing the body of a urinary bladder. The body wall of the urinary bladder is formed from the smooth muscles of the urinary bladder that are specialized, and they are called as the detrusal muscles, and they are going to contract on increased tension of the urine. So they are the specialized muscles, they are arranged on the wall of the urinary bladder, and then they are going to continue inferiorly in the urethra, and there is an extension here laterally. There is a presence of external urethral sphincter that is connected with the internal urethral sphincter, and the urine will going to dribble down from here to the exterior. So this was about the anatomy that we have discussed. The apex of the urinary bladder, we have discussed posterior base having the trigone of the urinary bladder, the two ureterics opening on the superior surface of urinary bladder, and we have discussed the inferior lateral surface converged to form the neck where the urethra is piercing the urinary bladder. Now we will going to discuss about the innervation of the urinary bladder, that how the urinary bladder is innervating and which nerves are going to innervate the urinary bladder. This is very important to learn, because if you know the milk urination that reflex can occur because of the sympathetic and parasympathetic innervation, the muscles is going to contract and relax, and the sphincters are going to relax, that causes the excretion of the urine to the exterior. Now here you can see this is shown the diagram of an innervating system of the urinary bladder. This is your spinal cord running from the medulla towards the level of the conus medullaris, and here this is the running sympathetic chain from the spinal cord at the level of T12 to L2. There is a sympathetic innervation mostly coming from L2. That's why they are marked the L2. From T12 to L2, the nerve fibers enter the sympathetic trunk. Here they will going to synapse in the ganglia, and then the postsynaptic nerve fiber of the sympathetic trunk will going to pass on to the body of the urinary bladder, and they will going to supply the detrusal muscle. They will going to relax the detrusal muscle and they will going to contract the sphincters. The function of sympathetic is to relax the muscle and they are going to contract the sphincters. So in this way they will inhibit the micronation. They will not causing the micronation, because the sympathetic is in a fight and flight response, so they will not causing any micronation at all. The second thing we can see in the innervation is from the parasympathetic, that is coming from the sacral nerves. The S1, S2 and S3, they are going to supply the parasympathetic innervation. From the parasympathetic nerves, they will going to supply the muscle and the urethra sphincters and the muscle are going to supply. The detrusal muscles are contractile. They are going to contract on the parasympathetic innervation, and the sphincters will going to relax, that is opposite towards the sympathetic nervous system. Here the detrusal muscle will going to contract and there will be contraction and there will be a release of the urine towards the exterior, and all these are the internal urethral sphincters. They are going to relax and there will be the micronation reflex occur. So you can say the parasympathetic is going to cause the micronation, while the sympathetic will going to inhibit the micronation reflex. Now the last nerve that is also coming from the S2, S3 and S4 is the pudendal nerve. The pudendal nerve is a somatic nerve. It is not the autonomic nerve like the sympathetic and parasympathetic. The pudendal nerve is a somatic nerve and is only going to supply the external sphincter. The external urethral sphincter that is present at the level of the urethra is going to supply it from the pudendal nerve. And this pudendal nerve will going to inhibit the sphincter to cause the release of the urine from the body of the bladder towards the exterior. So this is causing the micronation. At last, this is the role of the pudendal to cause the inhibition of the sphincter and cause the release of the urine. So this was about the innervation of the urinary bladder, and we have just discussed the anatomy. I hope you will be explaining well. Thank you for watching. Subscribe for more.